let's talk about subcutaneous injection. In the beginning, you will enter the room. When you enter the room, build rapport with your colleague, like, hello Liam, how are you? I'm Basant, I'm 1FY2 here. How's your shift today? So build rapport with your colleague. How's your shift? How's your rotation? Any interesting cases today? Any exams coming? I understand that you want to learn about subcutaneous injection. This is the introduction of any teaching scenario. Okay, what do you know about subcutaneous injection? And is there anything specific you want to learn about subcutaneous injection? And do you know what is subcutaneous injection? And when and why we need it? And then if he is saying something right, yes, you are right. That's good. I can see you understand about this. And if he doesn't know about these answers, you can say, okay, no worries, I'll explain everything to you now. Then explain what is subcutaneous injection. Subcutaneous injection is injection in the subcutaneous fat. Why we need it in case of giving specific medication like insulin, like heparin, like some vaccination, and also in some situation like palliative care. People can take like morphine subcutaneously. Then let me explain to you the sites of injection. You can inject subcutaneously in the arm, in the anterior thigh, and also in around the umbilicus and in the back behind the scapula. These are the sites. But please make sure do not inject many times in the same site and keep changing it. If you notice any redness, any scars, please avoid these sites. And then before giving any patient the medication, you need to make sure about that you are giving this to the right patient. Make sure that this is the patient, you need to give him the medication, confirm the patient identity, and then make sure this is the right medication and the right dose, and it's in the right time. And also repeat the route of the medication, make sure it's subcutaneously, and tell the patient about this and give them the right to refuse. And also after this, document everything which is the right documentation. So if you are going to say it, make sure that you are giving it to the right patient, right medication, right time, right route, right dose, and give the patient the right to refuse and right documentation. Okay? And if you are going to tell the patient about subcutaneous injection, you can say it in the form of PEPs. Well, at the moment, I'd like to give you some medication, subcutaneous injection. I'll give you, for example, heparin, and I'd like to give it in around the umbilicus. So please expose yourself around the umbilicus. So I'm talking about the procedure, the exposure, and I'll maintain your privacy, and I'll have a chaperone with me. Also, is that okay with you? So chaperone and consent. This is the way you will explain to your colleague. This is the way you need to tell the patient about taking the consent, and the ways that you are going to tell him about the procedures that you are going to do. Then prepare your equipment, like you need gloves, tray, syringe, needles, gauze, sharp pen, and medication. Okay, you will collect your tools, and then you will go for a mannequin to show him how to insert and how to inject subcutaneously. This is the step. First of all, wash your hand and wear gloves. Clean the skin with swab, pinch, fold of skin, and you can say also, please avoid pinching muscles while you are pinching the skin. Warn the patient about sharp scratch coming. Press 45 degree, gentle, remove it and put gentle pressure. Avoid rubbing. Document what you did, and also tell the patient about possible side effect after injection, like some soreness, some redness, and if this happen, please come back. Okay, so these are the steps of subcutaneous injection. After this, you will show your colleague the collecting tools, and then you can show him how to hold the skin, how to inject the medication. Then tell him about documentation. You can, if you have more time in the station, you can ask your colleague to recap or to repeat. You can ask him again, so do you know the 7 rights I told you about? Do you know how to inject it? Could you repeat that in front of me? Do you have any questions? And during the conversation, please make sure, am I going fast? Do you want me to repeat something? Is there anything not clear for you? And so on. Okay, in the exam, you will have a hand mannequin, and you need to teach your colleague how to give subcutaneous injection. In the beginning, you will wear gloves, prepare your equipment. You need 2 needles, syringe, the medication, swab, and cotton and plaster. In the beginning, you need to make sure that you are giving the right medication to the right patient with the right route and in the right time. Then you need to explain to the patient what you are going to do. By that, you can say, I need you to unexpose your arm if you are going to give it in the arm. And also, I need you to put your hand on the table, and then you will do the procedure with your colleague. In the beginning, you will clean the skin. Then you will prepare your medication. First needle to take the medication. For example, it's a heparin. You will take the right dose, and then you will change the needle, remove it in sharp pen, and then put the other needle, and then warn the patient, sharp scratch coming. Take fold of the skin, make sure you are not holding muscle in between, and then in 45 degree insert the needle. Before inserting the needle, warn the patient, sharp scratch coming, then insert 45 degree, give the medication, remove in sharp waist, apply pressure, do not rub, and then apply plaster. This is how to do subcutaneous injection.